Good morning. Happy Aloha Friday to all in the committee room, as well as to all of us joining us via YouTube or Zoom. Today is Friday, February 9th, 2024. We are here in conference room 329 at the State Capitol. It is the 8:30 a.m. agenda for the Joint Committees on Health and Homelessness and the Committee on Human Services. Members, we have a full day today. We want to welcome everybody here. For those of you who are joining us via Zoom, please chat with our technicians if there are any questions or issues. Should we lose power or any technical difficulties arise during the hearing, we will recess, and then I will post a notice to re-adjourn. Also, please, as part of your Zoom background, please do not use any copyrighted material, as that will then kick us off of the YouTube. So please, you can put a pretty picture behind you, just not something that's copyrighted. For the members as well as the community here, practice of this committees is to conduct DM at 11:30 a.m. You are welcome to stay here for that decision making, but we will take hearing testimony, open up for questions, and then move to DM at 11:30 a.m. So members, first up on our agenda is House Bill 1834 relating to the Department of Human Services, which appropriates funds to increase the Department of Human Services Homeless Programs Office budget. Members, this is a majority package bill that seeks to do something that we need to desperately do, I believe, and I believe all of the members of the Majority Caucus support that as well. First up, we have in-person testimony and support from the Department of Human Services.
Good morning, Chair Bellotti, Vice Chair Takanouchi, and Amato, and members. My name is Scott Morishige. I'm the Administrator of the Benefit, Employment, and Support Services Division at DHS on behalf of Director Betts. The department supports this measure, provided any appropriation does not reduce or replace priorities in the executive budget. We did include a request for a 5% increase in funding for contracted homeless services in the budget. However, a 20% increase, which we noted in our testimony of about $5.28 million, would better reflect increases in operating costs for providers that have occurred over the past 9 years. And this bill goes a long way to supporting the hard work of our homeless service providers who provide a continuum of services from outreach, shelter to permanent housing placement that help people go from street to home. So thank you for the opportunity to testify, and we're available for any questions.
Thank you. Testimony in support from the Department of Land and Natural Resources.
Aloha, Chair, Vice Chair, and members. Pua Ayu for the Department of Land and Natural Resources. We're in strong support of this bill, and we'll stand on our testimony.
Thank you. Testimony in support, Statewide Office on Homelessness and Housing Solutions. In support, State Health Planning and Development Agency. In support, Office of Hawaiian Affairs. In support, the Institute for Human Services. IHS.
Good morning, Chair, Vice Chair, and the committee. We very much support this bill, and we would also like to make the request to go from 5% to 20% on the contracts. The contracts haven't been increased over the past 10 years, and 5% barely makes for the inflation, so 20% would better reflect and help us serve our clients and also help our frontline staff get higher paying wages, because this is hard work and we need more staff for that. Thank you so much.
Thank you. We have testimony from Partners in Care in support via Zoom. Hawaii True Cost Coalition in support. Catholic Charities of Hawaii in support in person. Good morning.
Good morning, Chair Bellotti, Vice Chair Takanouchi. I'm Betty Lou Larson with Catholic Charities Hawaii, and we ask for your support because this is all about people, the people on the streets, but not only them. They need to have people who are trained, who have caring personalities, who have the skills to be able to move them, to gain their trust and help them on. I mean, case managers, the whole range of the continuum is desperately seeking people. Catholic Charities cannot hire people that we need. So in order to hire and then retain, because people deserve a living wage that they can pay rent themselves and not be threatened with homelessness. So this is about people, and therefore we do ask for that 20% raise in contract since we haven't had a raise in about 10 years. Thank you.
Thank you, Ms. Larson. Hawaii Youth Services Network in support. Dynamic Healing Center in support. Kealoha West Oahu in support. We have, again, Partners in Care, support for Annie Chamness. Hawaii Appleseed Center for Law and Economic Justice in support. Community Alliance Partner in support. LGF Consulting Hawaii in support. Aloha United Way in support. We have testimony from individuals, Will Caron, Cynthia Resentes, Maggie Derego, all in support. Any other testifiers? And we did receive a late testimony from two additional individuals. Any other late testimonies? Any other testifiers in the room? Any other testifiers via Zoom? Members, any questions? Seeing none, let's see. No questions? You have a question for DHS? DHS?
Would this money be used to pay people who have contracts with you more? Or just spread services out to new vendors?
Well, thank you for the question. So the intent is to increase the level of funding for our existing contracted providers. Again, because the level of funding hasn't increased in nearly a decade, and during that same period, operating costs such as wages have increased significantly.
Thank you.
Thank you.
Thank you. Okay, seeing no other questions, moving on to House Bill 2448, relating to mental health services for children and adolescents. Testimony in support from the Hawaii State Department of Health.
Aloha, Chair, Vice Chair, committee members. My name is Kaylee Aquaro. I am the Acting Administrator for the Department of Health, Child and Adolescent Mental Health Division. We stand on our written testimony in strong support of this bill. I just want to note for committee members that the statute is 50 years old, and so our goal here is to update it to reflect the current work of the Child and Adolescent Mental Health Division in the state of Hawaii. Appreciate the opportunity to testify, available for questions.
Thank you. Testimony in support, Office of Public Defender via Zoom.
Aloha. My name is Darcia Forrester. I am the supervisor of the Juvenile Division at the Office of the Public Defender. We are in strong support of this measure, and we'll stand on our written testimony. Thank you.
Thank you. Testimony in support from the Office of Wellness and Resilience.
Aloha, Chair, Vice Chair, Tia Hartsock, Executive Director, Office of Wellness and Resilience. Just stand on our testimony in strong support. Mahalo.
Thank you. No late testimony? Seeing none. Any other testifiers via Zoom? Any other testifiers in the room? Seeing none. Members, any questions? Seeing none, we will move on to House Bill 2042. This is an appropriation fund to address mental health and wellness needs of youth in the state. We have testimony first in support from the Hawaii State Department of Health.
Aloha, Chair, Vice Chair, and committee members. Kaylee Aquaro, Child and Adolescent Mental Health Division. We stand on our written testimony in support of this bill, and we'd just like to note that any contract awarded would be the result of a competitive procurement process as dictated by Hawaii procurement laws. Thank you for the opportunity to testify here for questions.
Thank you. Testimony in support from the Office of the Public Defender.
Aloha again, Darcia Forrester from the Office of the Public Defender. We are in strong support of this bill. We've submitted written testimony, and we'll stand on our written testimony. Thank you very much.
Thank you, Ms. Forrester. Office of Wellness and Resilience, in support? Thank you. We have testimony in support from the Office of Hawaiian Affairs, testimony in support from the, oh, wonderful, thank you.
Aloha, Chair Baladi, Vice Chairs Takanouchi and Amato, and members of the committee. My name is Kaylee E. Nixon. I'm a public policy advocate with the Office of Hawaiian Affairs, and we will stand on our written testimony. Mahalo.
Thank you. Testimony in support, Disability and Communications Access Board. Testimony in support from YMCA of Honolulu.
Good morning, Chair Belatti, Vice Chair Takenouchi, and distinguished members. My name is Kyle Ishizaka, and I'm responsible for the WISE mental health initiatives. The WISE has been delivering mental health programs to 9 DOE middle schools and high schools on Oahu. This bill would help to expand those resources to provide screening, prevention, intervention services throughout the state. Our program will teach skills to manage emotions and coping strategies and assist youth to deal with their mental state. Through social prescribing, youth will build protective factors, all effective methods recommended by licensed therapists. Results from the WISE mental health program help youth become more aware of their mental health condition, learn coping skills, and increase their support network. Teens in our intervention program utilize skills learned, and they used it in real-life situations, and many of them have joined clubs, learned new hobbies, and have improved their physical health. All habits that will help them sustain their mental health and social connections. Through Bill 2042, community-based organizations will be able to provide mental health services to teens statewide, and we are also open to the RFI process.
Thank you. Testimony in support from, we also had Greg Weibel from YMCA. Okay. Testimony in support, Catholic Charities of Hawaii. Thank you. Testimony in support, Mental Health America of Hawaii. Testimony in support, Hawaii Substance Abuse Coalition. In support, Hawaii True Cost Coalition. Hawaii Youth Services Network in support. Testimony in support by Opportunity Youth Action Hawaii. Testimony in support, Democratic Party of Hawaii. Testimony in support from individuals Will Carone, Claudia Christ, Robin Miyamoto, and Amy Grace. Okay, any other late testimony? Seeing none, members, seeing any other testifiers in the room, any other testifiers via Zoom? Seeing none, members, questions? I have a question for, I think it's for CAM HD, although I know you did not weigh in. Were you or any persons in the Department of Health that oversee contracts for mental health with children and adolescents involved in this pilot project with YMCA?
No, we were not. We did not contract for that service.
Okay. Question for YMCA. If you could come to the... First, I want to say I'm super supportive and happy that you guys took on this pilot program. I guess what's interesting is that you guys did a mental health screening process.
Yes.
And this committee became aware during one of our informational briefings prior to session really gearing up that there is a Department of Health grant where they are looking at, trying to reach out and getting screenings out to more folks, pediatric mental health. I know that there's also a pilot program within Department of Health, maybe not in the CAM HD section, but looking at working with community partners, groups such as the YMCA, where they coordinate the mental health screening process. What screening process did you use?
So we use a screening tool, and it's from the Minnesota Department of Health. And through Mental Health America and other professionals, they helped us to vet that tool and saw that that was something that we could utilize for our program.
Were you working with any department agencies?
Yes.
Through the execution of the pilot program?
We got consultation. Greg met with Dr. Fink and other people from the Department of Health, and he shared what our program and our curriculum and what our services look like. And through their feedback, we helped to really define the screening process, looking at questions asked, and then determining whether or not they would be more appropriate for prevention or intervention services.
Okay, and then when the students got follow-up mental health services, say someone might have been hitting some critical point, what was the part of the follow-up from your program or the mental health provider who was helping them? Because, I mean, your outcomes seem hugely successful, but I just want to understand how the child flowed through your process to get help?
Okay, so what we've tailored our program after is the school-based substance abuse treatment program that is also funded by the state legislature. So monies come through the Department of Health, Alcohol and Drug Abuse Division. So we use that same principle, we're using school-based, and we went out and met with the district supervisors for the DOE after we met with the Department of Health, and we introduced the program to them, and they helped us to identifying the schools that we were looking at providing services at. And from there, that's where we get the referrals from the school principals, from the counselors, and if a student is beyond our needs, then we would be referring them back to the SPBH counselor, or we'll look at appropriate professionals out in the community to link them up to.
So I think this is really fascinating because this committee understands that there is a lot of work going on within DOH to really kind of understand what the array of services are out there for children and youth. And that's partly connected to the first bill we heard related to their updating of their statute. So I think you guys are working in a really interesting space, and I appreciate it. And I think my comment to you would be to continue to engage those departments and make sure that those departments are talking to one another, right?
We're trying.
Because they don't often talk to one another, and sometimes it takes the community to bring them together.
Yeah.
But as we say we were to scale this up in a more formal way, then those things like assessments and screenings have to be things that the department then recognizes and that insurers then recognize, so that as we build out this array of services and systems, we actually can start to build it out and make the people who are responsible for paying it pay for it. Shared cost, it might be a combination of insurers, it might be a combination of private pay, and it is a combination of state resources. So if this bill moves forward, you know, that kind of conversation and engagement with the departments is really important. And I don't need to place it on you. I'm also saying this because it's about everybody doing that, but it's really quite amazing what you folks have done.
Thank you. And we'll be willing to work with whatever state departments to try and get, so that it is become more seamless and there is communication.
And they have federal grants to help with that. So they should be reaching out to you folks for that. Members, any other questions, comments? Okay, thank you, sir.
Thank you.
Seeing no other questions, moving on to House Bill 2182. This is relating to community health workers, a pilot program, 3-year pilot program for for Ka'u, sorry. We have comments via Zoom by the Hawaii State Department of Health. Comments?
Good morning. Good morning. This is Matthew Shim, Chief of the Family Health Services Division. We will stand on our written testimony, providing comments. I do just want to highlight the fact that Department of Health does not have legal authority to authorize community health workers to provide outreach, education, training, or navigation services. Also, if the bill passes and it lands in the Department of Health, it would probably land with our Office of Primary Care and Rural Health. Those folks are all funded by federal grants and are not allowed to work on projects outside of their grant deliverables. Thank you. I'm here to answer any questions.
Okay, we have testimony in support from the Office of Hawaiian Affairs.
Aloha, Chair Belatti, Chair Martin, Vice Chairs Takanouchi and Amato, and members of the committee. Kaylee E. Nixon from the Office of Hawaiian Affairs, where we'll stand on our written testimony. Mahalo.
Thank you. We have testimony in support from the State Health Planning and Development Agency. Testimony in support from Papa'ololokahi. Testimony, comments from Claudia Hartz. We have late testimony in support from Jennifer Wayan Kalani Shrestha. Any other testifiers here in the room? Any other testifiers via Zoom? Members, questions? I believe I have some questions. For Department of Health,
Yes, Chair.
can you speak to a little bit about what the Office of Primary Care and Rural Health does?
So our Office of Primary Care Rural Health, we have 4 federal grants. The first one is our state primary care office, which provides the data and research to create health professional shortage areas. So providers can request loan repayment through several federal programs. We also have our State Office of Rural Health, which helps organizations like the Hawaii State Rural Health Association. We also have 2 federal programs for our critical access hospitals. One is the SHIP program, which is the Small Hospital Improvement Program, and then the Medicaid Flex program to support the critical access hospitals.
What was that last one, Medicaid?
Flex, the Flex program.
And what does that do?
That provides the critical access hospitals with continuous quality improvement to increase their ability to bill for Medicaid services.
Go ahead, Representative.
Matthew, I appreciate the vagueness of the bill and your inability to address social determinants of health. So what I considered social determinants of health is, for instance, poverty, being on welfare, being in a single-family home, being unemployed. Those, I think, are what I would call social determinants of health. If you have any one of those, you're likely to have worse health. Although in some cases you may have one or more of these and be in good health. So maybe we need help in trying to figure out what Ka'u needs other than a broad brush look at addressing social determinants of health. Thank you.
Thank you for your comment. Is there anyone from DHS who's present?
Lots.
Is there anyone from a FQHC who is present? Okay, Department of Health, you're up. And that's
Chair.
you. Okay. So one of the things happening nationally is that community health workers are actually identified as a class of potential workers who can draw down on Medicaid services. They sit in this space between community and the medical system. And in other states, they're looking at how we can reimburse the services of community health workers who can help navigate systems in places like connecting folks to FQHCs and to community care. Can you, from your position in the Department of Health, comment on the trends of that community health worker designation that in fact prompted the auditor study that is mentioned in this bill? And what the department has done, if anything, to begin to identify and how to integrate community health workers into our system of care?
So I know that our State Office of Rural Health has been working with our chronic disease branch, who oversees some of the community health worker type programs. Also, they've been working with the Hawaii Community Health Worker Association to look at the different ways that community health workers, hopefully, through legislation or different policies, could become licensed or certified for reimbursements.
So that's the HCHW. Okay.
Yes.
And then the chronic disease branch, you said Office of Rural Health has been working with the chronic disease branch on different projects. What are those projects? Can you expand?
So I'm not 100% clear on everything that they're doing, but I know that part of the chronic disease branch, they have bilingual health aides who basically work as community health workers or community health worker type, and provide that bilingual health translation services between health services and patients.
Yes. Mr. Shim, there's actually someone else from the Department of Health here who might be able to come up and speak to it. So Ms. Irvine, and also what I would say is, as she's coming to the podium, what we saw in the pandemic was the emergence and the reliance on community health workers who helped us connect to communities that we could not normally reach. They helped us with vaccination programs. They helped us to educate the community about pandemic issues. They helped us connect the community. And so that's why this is a very important bill, because it's starting to set into motion, and maybe not even start setting into motion, it's actually crystallizing a direction that different parts of your department have been touching on. And so maybe Ms. Irvine, can you explain what you'd like to on this issue?
Thank you, Chair Bellotti, and I thank my colleague, Dr. Matthew Shim, for referring to our division. So our division we actually started with it in a federal program called DP 1815, which would make it starting in 2018. And so the federal government had provided attention and really basically mandated in the grant that we would start looking into building the capacity of community health workers in Hawaii. One of the things we quickly realized, or perhaps not quickly enough, is that within our division we had 10 bilingual health aides who, in terms of then their capacity as really community navigators who have lived experience in the various language communities that they are from, are valuable, really, assets within our department. And so they work with, for example, the public health nurses branch. So if there's like TB compliance, they can go with the public health nurse and actually be a navigator for them in terms of within the community, and assure that there would be medication compliance by having that relationship within that community. They may also then refer them to other services. So we've integrated them better into our programs, for example, and the offerings we have. I know I've come before you with things like the breast cancer and cervical cancer screening program. And so we've tied them into that so that they can then refer people to the FQHCs that do have contracts with us to provide the free screening programs for people who are uninsured and underinsured. And then I thank this body because during the pandemic, 3 of our bilingual health aid positions were defunded, and now they are refunded, and we're back into recruiting back into those positions. We also have contracted easy language access contractors, because once someone's in civil service and say, for example, they speak Korean, we can't turn around and say, we're seeing a lot more Spanish-speaking people. Can you speak Spanish? So the easy access contractors, actually as contractors, we can get then language bilingual health aides who speak languages that are emerging in Hawaii. So during the pandemic, they were key in terms of then introducing some of our colleagues and the capacity that they built up with contact tracers. So they worked alongside them. We have had other federal grants that have then we built onto what we started. And as Dr. Matt Shim said, with the primary care program and rural health program, we have worked alongside them. So we're known as the allies, and there's a Community Health Worker Association website, and they have actually a board, and they have then self-determination of their direction, and we provide funding and support. So currently we have a federal grant, and Chair, just stop me if I'm saying too much.
Can you wrap it up, like in 30 seconds?
Yes.
So different multiple federal grants
Yes.
over the past 5 years
Yes.
to scale up and define programs for community health workers.
And to
where is the
provide the
status of
capacity.
do you have a report back to the federal government or to the body, the state legislature or the governor, to show us what you folks have been doing and how we might be able to scale it up and integrate it further into the system?
We have been reporting to the federal government. I can look and see what our latest reports are. They are going to speak specifically to what we call the performance measures, and so we'll have to put it into. We will see what we can share with you, and we have actually written that up into our budget request as well.
Okay. Is this ongoing annual funding by the federal government, or was this a time-limited federal grant?
Time-limited federal grant, the ending is August 2024. We are hopefully going to get a no-cost extension so that we can support some of our contracts so they can have a little bit more time on them. So for example, Kapi'olani Community College is providing community health worker trainings, and they provide certification. For the completion of those trainings, we also have funded the University of Hawaii Department of Native Hawaiian Health, and they provide in-service training at the location. So for example, with the Native Hawaiian healthcare system or the FQHCs where the CHWs are.
Okay, I think you can pause. I think that's a lot of information. I actually think that this is subject for further investigation by this committee, because the work that you might be doing needs to come out. And we need to understand the work that's being done, because the next horizon for this and what's happening in other states is that community health workers are being recognized either through certification, and then they are being utilized in the system and reimbursed through private pay insurance as well as state insurance. And so that's how we make these things sustainable. That's how we make the continuum of care able to be paid for beyond just state resources. And I bet you the health plans understand this, because health plans like Aloha Care have been working with community health workers at great lengths in some of our Native Hawaiian communities. I know that there have been community health workers in my district, in Papukolea, and they've been kind of modeling that community health worker. But one of the things they struggle with is, how do you define them? How do you define their service, what they're doing to connect people to valuable health services and access? And that's the next horizon that everyone in this committee needs to be understanding and moving towards. It cannot just sit in the Department of Health and spin.
Ma'am, may I speak to that?
Yes, please comment.
So the 1115 waiver that MedQuest submitted recently does include community health workers as part of the team of care. And we have been working with Aloha Care and the Papukolea community health workers. We have actually provided funding for continued services to extend beyond the pandemic period. And that's with federal dollars. And we have been working on the system of care so that they would be a reimbursable group within the system of care with private providers. And we have been part of a meeting with Senator Drew Kanuha, who had introduced a bill, and that was the premise for this sunset report by the State Auditor's Office.
So there's a definition, since you bring up the 1115 waiver, there's a definition of community health worker in that.
I would have to defer to MedQuest in terms of whether there is that definition, but DHS is also very well aware. So it's UH-JABSM, who is also relying on community health workers as part of their community engagement and community-based approach.
Okay. And then is there a definition of rural as well? Because I know
Yes, there's a federal definition that Dr. Matt Shim's program relies on.
The reason I asked that is because while I respect the introducer's intention to create the pilot program in Ka'u, I actually think the pilot program should be created for rural communities. So that I would like at some point some definitions maybe provided by the Department of Health and Department of Human Services for what rural is defined as.
Thank you, Chair. I'll take that question back and work with my colleagues. We did pull that out for one of our federal grants, and we can share that back with you, and we will email that to you as soon as possible.
Yes, this is why we have hearings, because we can better refine bills. Thank you. Members, any questions? And thank you for indulging in my questions.
Thank you.
Thank you. All right, moving on to relating to medical transportation. Oh, yes, medical transportation. House Bill 2544. Comments from Hawaii Department of Health?
Good morning, and Kunki Fatchoy. Lauren Kim, Policy and Planning Officer for the Department of Health. We have submitted comments noting that we do acknowledge that there must be frustration and perhaps anxiety when people cannot, especially on neighbor islands, can't get to their routine medical appointments, especially if it's for important matters such as chemotherapy. We do want to share that a program of this magnitude would be significant and that it would need to be resourced, even if it were contracted out, because it does require an agency such as the Department of Health, which is proposed, to acquire quite a bit of new expertise and experience that we do not already possess. We also point out there are other less resource-intensive available levers to lean on, such as network adequacy, spelled out in statute, and that can leverage existing contractual expectations of health plans and healthcare providers. And lastly, this may benefit from further discussion. What this looks like, what it involves, what the scope is, what the reimbursement methodologies are. For example, MedQuest already has an inter-island transportation benefit, as well as we offer specific suggestions on how we can refine the proposed model, including some sort of public-private partnership or some agreement among the private sector to create a corporate account or specific account that lets providers and patients reserve directly. So we have some specific ideas that we can offer to this committee. Noting that, there are a lot of reasons why flights get canceled, especially for some of the smaller islands with some of the smaller populations. Market forces is probably the only variable that this measure would impact, and it could be a meaningful impact if, for example, an airline were guaranteed income on those empty seats that they could be flying back and forth with. So if this remains a priority to the legislature, we think taking a step back and thinking about program design, this is a hybrid of a health plan, a travel agency, and a case management agency, and probably things that I can't think of, not are readily coming to mind, or whether this is an open market model where we just create a space for the private sector to come together and say, here's a way to monetize fallow resources such as empty seats. So I think there's more discussion that can be had, and we look forward to being a part of it and helping to solve this problem. Thank you, and available for questions.
Thank you. Testimony, comments from Department of Human Services. Are they present? Department of Human Services? Okay. Maui County Council, support via Zoom.
Aloha, chairs, vice chairs, and honorable committee members. Maui County Councilmember Kiani Rollins Fernandez here in strong support of HB 2544. Mahalo nui for scheduling this measure and for your consideration of this creative pilot program that could really help our Molokai and Lena'i communities. I'll stand on my written testimony and be available if there are any questions. Mahalo.
Thank you, Council Member. Testimony in support, Hawaii Pacific Health. Testimony in support, HMSA.
Good morning, Chair Belatti, Chair Martin, Vice Chair Takenouchi, Vice Chair Amato, Representative Kobayashi. Thank you for allowing us to come to testify in support of 2544, Walden Al from HMSA. Really important issue, and we hope that this discussion will continue.
Thank you. Testimony in support from Aloha Care.
Good morning, chairs, vice chairs, members. Mike Nguyen with Aloha Care. We obviously submitted testimony in writing, and we stand on that testimony. We are in support of the intent of the measure. Obviously, it's an initial discussion, and we look forward to participating. We have questions as to how it might work, how it will be funded, and all of that. So thank you. Happy to answer any questions.
Thank you. Thank you. Next up, testimony in support from Molokai Drugs Incorporated, which I know they're here. Thank you for joining us, Ms. Fedman.
Good morning, Chair Al Belatti, Vice Chair Takenouchi, and members of the Committee of Health and Homelessness. If you saw your packet, there are 61 pages of testimony for this bill, HB 2544. I know that there are other people on Molokai who did not testify, but will possibly testify if this passes out of committee. I stand by my testimony that was submitted, and I also volunteer my time as the president of Molokai Drugs to sit on this committee. I know Lauren Pang brought up some really, really good points just now, but this is a critical issue. Transportation and medical are two of the biggest issues on Molokai. We are losing a lot of our patients. We are losing, not just by death, but people relocating out of the state for medical. I have friends who are my age who are relocating their parents to the mainland. The most recent was a friend in California, relocated her mom to Los Angeles she said, because of the inconsistencies of flights with the carrier that we have servicing our island. I am available for any questions, and I stand by my testimony. Thank you.
Thank you for joining us. In support from Indivisible Hawaii Healthcare Team, in support Hawaii Medical Association, in support Aircraft Owners and Pilots Association, testimony in support from Kapa'akea Hawaiian Homestead Association, testimony in support via here in person, Austin Johansson.
Aloha, Chair, Vice Chairs, Representatives. Thank you for allowing me to submit testimony. Stand by my written testimony, and I'm available for any questions. I'm also the General Manager for Kamaka Air. We've just started offering passenger charters in May of 2023. Any questions? I'm available for questions. Mahalo.
Thank you, Mr. Johansson. Testimony in support from an individual named Malia via Zoom. We have testimony in support from numerous other individuals and late testimony as well from numerous individuals. Any testifiers in the room? Any testifiers via Zoom? Members, questions? I have a question.
Lots of testimony.
Yes, lots of testimony. I believe, Mr. Johansson, you said if you could come up. Can you mentioned the Kamakea?
Kamaka Air.
Can you explain what Kamaka Air is?
Kamaka Air, for the past 30 years, has been the air freight provider from Honolulu to Molokai, Molokai and Lanai. In 2019, started from Kahalui to Molokai and Lanai cargo service. And then in May, we started passenger service. We have one passenger aircraft that we brought on board. We have offered emergency medical services, not non-ambulatory, and hospice service. Charter flights are a more pricey option, but that's what Kamaka Air is providing right now.
Okay. So I'm sorry, I'm reading this testimony from AOPA, which is?
The Airline Owner Pilots Association?
Yes.
Yes.
Are you involved in this organization?
I am a member of AOPA.
What intrigues me is that they have, it sounds like they have a pilot program that has been utilized in other places. Can you speak to that?
Unfortunately, I can't speak to that, but I could reach out to AOPA members in our community and hear back from them.
Okay, because what it reads here is that this kind of model might have been utilized following the wildfires in California, and that's what the basis of this pilot program may sort of model. Yes, it would be very interesting to understand how this might be part of a pilot program. So if you could reach out to AOPA to provide more information, this is very intriguing.
Okay, yep, I definitely will. Thank you.
Go ahead.
Sorry, I have another question. So are your flights with humans, are they chartered specifically, or do you have any regular ones that are already pre-scheduled?
They're chartered specifically, so that means that the passengers are able to, they choose what time they want to leave, where they want to go, and this is our first step. We're open to looking at things, but granted, this is a small company.
What is the cost difference between buying a seat on a regular regular airline and buying a seat with you folks?
So because we're only allowed charters, we can only sell the entire airplane. We can't sell per seat on that aircraft. So for all 8 seats on our passenger aircraft from Honolulu to Molokai one way is roughly a little bit less than $2,600 versus, I believe, on the passenger air carriers, maybe 120 or so. I'm sure our community in Molokai, you could speak more to that.
So the amount was, can you? Okay, so divided by 8 would give us, and then you said the seat.
But only if they fill all 8.
And then the seats per,
The seats for the
Commercial.
other airlines, yeah, the per passenger airlines, I'm not too sure exactly.
all right, thank you.
Thank you.
Mr. Kim? What, are you okay?
Not sure.
Mr. Kim, it looks like your department has been like kind of struggling with this issue, this question, because you lay out a couple of options.
That's fair to say, yes. It's a complex issue. We don't have a straightforward answer, just some options.
So can you expand upon concept 2? And if we were to initiate a pilot program, I mean, conceivably, you could design a program where you paid for seats if you use them. I mean, yes, you know, there might be the situation with the charter plane that you would have to fill it up, but you could also design a program so we would not just have to be stuck with the model of pay for it whether it's being used or not. You see what I'm saying?
I do, and my first response to that is the department alone cannot conceptualize this program. We would need the people sitting in equal seats across the table from us from the airline industry, because it does come down to the bottom line. So I cannot speak for the airline to say that they would rather, I just imagine they would rather have a guaranteed payment than a 50-50 chance or a 0% chance when they know there's no one booked in the seat. So there are many other stakeholders, and like I said, this involves expertise that we have no experience with. So to go further with concept 2, we would really need to sit down and understand what does it take to motivate, what's the profit motive, specific motive for an airline to fill a seat, who are we competing against, what those timetables are, when peak appointment times are, ground transportation. So there's a lot of logistics that get involved, and which is why my comment is, if we were to contract this out, could it be an existing entity like a travel agency or a case management agency? So the travel agency obviously understands airline schedules, protocol, transportation. Case management understands dealing with the front office of a provider, medical transportation, transportation of specimens, lab reports, et cetera, et cetera. So we're really getting into new territory, and I think we need many stakeholders around the table to make this happen. And if the legislature moves forward with a more deliberative approach, and I'm jumping ahead, so please pardon me, I recommend that any sort of task force be authorized by concurrent resolution, just for ease of administration.
Or by bill.
That is your prerogative, certainly. I would write the concurrent resolution if you wish. But it's worth thinking about. I mean, this is a problem. And again, we do offer that there are other levers that could be thought about in unison or standalone. Network adequacy, contractual items when UTF goes out or Medicaid goes out to recontract. What kind of contractual levers does the state have to assure greater availability of inter-island transport? So it isn't all of the above because it is such a complex problem.
Yeah, and Medicaid certainly, when they pay for it, they're not just paying for empty seats flying, like being flown. They're probably paying for the seat when it is used. So that, again, the model is there already in Medicaid.
I don't know if it's a model. Certainly the resources are there, and I don't want to speak for my DHS colleagues, but reading their testimony, if it's medically necessary. So this model, the introducer of this proposal would like caregivers to be a part of that. And I don't know if any health plan, and I just don't know this, would consider that medical necessity unless it's, say, a minor. Again, I'm speculating. I don't want to speak on behalf of health plans or Medicaid, but there are features, shall we call it, of this proposal that, may run into some scrutiny.
Okay, thank you. Members, any other questions? Go ahead, Representative Martin.
I really appreciate how much you're thinking about this. I know from our testimony we see it's such a huge problem. And I like the idea of possibly having coordination across insurance plans, including Medicaid, maybe to guarantee a certain number of commercial seats on regular airplanes by coordinating appointments, right? To have we have appointment Tuesdays and Fridays or whatever it is, and everybody does them on the same day on purpose, and that could guarantee the airline some critical mass that allows them to fly at their regular rates without, having taxpayers pay a premium.
I think that is on paper the ideal. That's the win-win-win situation. Again, it is a heavy lift, whether it's in a department, whether it's contracted out, whether it's perhaps an administratively attached agency, perhaps an office of the patient ombudsman that deals with consumer issues. Just kind of brainstorming as I stand up here.
I think we should put it with the Department of Health. Stop trying to push it out to somebody else.
You are wise to my testimony ways, Chair. Okay. So whether it is in a newly created patient office of patient ombudsman or some unnamed agency, I think further discussion in the department stands by to be a part of that discussion and be a part of the solution. So.
Thank you. Any other questions? Members, we actually have Zoom testifiers who are here. We have Valerie Janikowski, if you want to turn on, and then we'll take Shirley Samante and Valerie next. So first up, Valerie Janikowski.
Hi, I'm Valerie Janikowski. Thank you very much for allowing me to testify in support of this measure. I'm testifying as an individual cancer patient who has to travel off island for medical appointments on a regular basis. It is frustrating at best. I have completed my treatment and chose to complete the actual radiation treatment on Maui because flights to Honolulu, to where I usually go, were almost inaccessible and no guarantee. Secondly, I would like to also support this as a nurse. There are people, I've had colleagues that have left the island because healthcare needs are beyond what they would be able to achieve on the island, and travel is very difficult to go for specialty services. And as a nurse, I take care of individuals that are delaying or avoiding healthcare, the necessary healthcare, because they are challenged with the travels, challenged with getting on certain types of planes, challenges with the sitting in waiting areas after a procedure for 6, 8, 10 hours to have their flight canceled. Anyway, I just hope that there is something that can be done. I hope that this just keeps moving forward, not getting pushed off to certain different committees. If there is a committee, I hope it continues to move forward. And I know there are representatives from Lanai that would be happy to participate. Thank you again for your time. I appreciate it.
Thank you. This will move to a second committee, Finance, so it does have more hearings, and it'll likely move over to the Senate. So there will be, the process, ma'am, is just that it will have to continue on. And this kind of engagement is really important with the community. Next up, so thank you for joining us. I know we have another one, Ms. Samante, or the second Zoom participant, are you there? Not there? We'll wait for her. She's logging on.
Hello.
Okay, we're going to have to move on. So I believe we may have her testimony, so, and I assume it's testimony in support. If she does log on, we'll bring her back. Okay, moving on to House Bill 1777. This is relating to dental hygienists. Members, we have in support via Zoom, State Department of Health.
Good morning. I'm Matt Shim, Chief of the Family Health Services Division. The department stands on its testimony in support, and I'm here to answer any questions. Thank you.
Thank you. We have testimony in support, Department of Education. Testimony in person, UH School of Nursing. Aloha.
Aloha. Good morning, Chairs Bellotti and Martin, Vice Chairs Takanouchi and Amato.
Okay.
My name is Clementina Seria Uleb. I'm the Dean of the UH School of Nursing at Manoa. So we support this measure, and thank you for providing me the opportunity to attend the hearing and provide testimony in support.
Thank you. Do we have the Zoom testifier for the previous? Okay. Next up, we have testimony in person, Board of Dentistry.
Good morning, chairs, vice chairs, members of the committee. My name is Sheena Choi, Executive Officer of the Board of Dentistry. The board stands on its written testimony. I'm available for any questions. Thank you.
Thank you. Testimony in support, HDA. Wonderful.
Aloha, Chair Bellotti, Chair Martin, Chair Takanuchi, Vice Chair Amato, and members of the committee. My name is Dr. Rachel DePasquale. I am a member dentist of the Hawaii Dental Association. The Hawaii Dental Association is a professional association comprised of approximately 950 member dentists. We are in support of House Bill 1777 relating to dental hygienists. This bill authorizes dental hygienists who are under the direct supervision of a licensed dentist to perform preventive dental sealant screenings and apply dental sealants on certain individuals in a school-based oral health program. This February hearing could not be timelier, coming during Children's Oral Health Month. We have participated in stakeholder meetings with other members of the Oral Health Coalition as this bill was being conceived, and we support it. HDA's longstanding commitment to the health and well-being of Hawaii's keiki will culminate in its annual free children's oral health clinic at the Waikiki Health Clinic, Makihiki Clinic on February 24th, and we will continue to advocate for policies that improve children's oral health each and every day. HDA is a statewide membership organization representing dentists practicing in Hawaii and licensed by the State of Hawaii's Board of Dentistry. HDA members are committed to protecting oral health and well-being of people of Hawaii from keiki to kupuna and everyone in between. Mahalo for the opportunity to testify.
Thank you. We have testimony from Aloha Care. Testimony via Zoom, Hawaii Children's Action Network. That's via Zoom, Hawaii Children's Action Network.
Hi, aloha chairs, vice chairs, and members of the committees. My name is Chevelle Davis, Director of Early Childhood and Health Policy with Hawaii Children's Action Network Speaks, standing on our written testimony in strong support. Mahalo for the opportunity to testify on this measure.
Yes, okay, thank you. Sorry, going back to Aloha Care, did you want to stand on your support? Okay, thank you. Testimony in support, Hawaii Dental Hygienists Association via Zoom. HDHA.
Morning, Chair Bellotti, Vice Chairs and committee members. Ellie Kelly Miyashiro, on behalf of the Hawaii Dental Hygienists Association, we stand on our written testimony in strong support of House Bill 1777.
Wonderful, thank you. Testimony in support, Hawaii Oral Health Coalition via Zoom.
Hi, good morning, chairs, vice chairs, and members of the committees. I'm Patrick Donnelly, and I represent the Hawaii Oral Health Coalition in strong support of the measure. I just want to, we stand on our written testimony. I just want to highlight that our coalition convenes dental providers and community stakeholders from across the state to address really pressing administrative and physical barriers. And this bill, as it's written, alleviates a really significant barrier to providing dental sealants in school settings, which is really where we have some of the greatest opportunity to reach vulnerable children and actually connect them with regular sources of care. So ultimately, it'll enhance the impact of existing programs, and it'll encourage greater investment among providers who want to expand their services into the community as well. So thank you so much for your time and consideration and opportunity to testify.
Thank you. Thank you for joining us. We have testimony from a number of individuals in support. Any other testifiers in the room? Any other testifiers on Zoom? Members, any questions? I have a question for Department of Health. So
Yes, Chair.
I understand how this amending language is more specific to allow for school-based oral health programs. I guess, I had assumed that we had already dealt with this issue when we enacted language in section D that says general supervision is permitted in a public health setting. Was this not sufficient to cover this situation?
This, I believe, is specific to applying dental sealants, which is not covered in the broader hygienists being able to work within their license in a public health setting.
Okay, maybe HDS. No, I understand. Can I HDS come up? I'm sorry.
Aloha, I'm Melissa Pavlicek on behalf of the Hawaii Dental Association. We did support the language in a prior session to allow dental hygienists to operate under the general supervision of dentists. I believe the application of sealants does need this legislation, and we can look into it further and get back to the committee. We've been working with the Hawaii Oral Health Coalition, which many of the testifiers participate in, and I think there was a bit of an assumption on many of our parts that we did actually need to expressly authorize this sealant application, but I'd be glad to double check and make sure that we actually need this bill, because if we could do it without it, that'd be amazing too.
Okay, and then are there anything else other than the application of dental sealants that would be possible to be doing in the school-based health setting so that we can take care of this all at once, potentially?
I guess that's something that we could look at and get back to you as well in terms of expanding care or whatever else. But I think one of the testifiers mentioned just wanting to connect children to dental care, a dental home, and make sure that a dentist is seeing them on a regular basis. That is the goal.
Okay, thank you.
Thank you.
Thank you, Ms. Pavlicek. Members, any other questions? Okay, moving on to House Bill 2744, testimony and support via Zoom. Department of Health.
Good morning, Matt Shim, Chief of the Family Health Services Division. The department stands on its testimony and support, and I'm here to answer any questions. Thank you.
Thank you. Testimony and support, Department of Human Services. Testimony and support, Hawaii State Council on Developmental Disabilities. Thank you. Comments from Office of Information Practices? Testimony and support, UH School of Nursing.
From the School of Nursing, we stand in support of this bill. Thank you.
Thank you. Disability and Communication Access Board, comments. Hawaii Dental Service in support. Hawaii Dental Hygienists Association in support via Zoom.
Good morning, Ellie Kelly Miyashiro on behalf of HDHA. We stand in support of our written testimony.
Thank you. Testimony in support, Hawaii Oral Health Coalition, Hawaii Public Health Institute.
Hi, good morning, chairs, vice chairs. Patrick Donnelly with the Hawaii Oral Health Coalition. We're in strong support of this measure, and I just also want to add that, there really are a lot of great efforts that are happening individually within the community, but because there's been no formal Department of Health oral health branch for the past 15 years, our outcomes continue to worsen in the community, and we really need a coordinated state effort to more thoroughly understand what the gaps and barriers are to accessing adequate oral health care, and more importantly, to effectively address them. The appropriation request in this measure is a mere drop in the bucket compared to the millions that are charged to the state for preventable oral health conditions in emergency departments. And so I really appreciate your consideration for establishing an oral health task force. It's a critical first step to addressing the significant disparities that we see in Hawaii. So thank you so much for the opportunity to testify.
Thank you. Testimony and support from Papa Ololakahi. Testimony and support from Aloha Care. Thank you. Hawaii Dental Association, comments.
Good morning, chairs, vice chairs. The Hawaii Dental Association is writing to comment on this bill. We respectfully request that at least one dentist from each county be considered for the inclusion of the task force. Thank you.
Okay, we have testimony in support from Hawaii Disability Rights Center. Testimony in person, Mr. Sand? Dr. Sand?
Aloha, Chair Martin, Chair Balate, Vice Chair Takanuchi, and Vice Chair Amato. I am amazed at how hard you guys work, and Representative Professor Kobayashi as well. The amount of ground you guys cover, it's amazing. My name is Dr. Don Sand. Myself and many mission-minded frontline dentists support the bill of HB 2744 with a request for amend language. I stand on my written testimony. With your permission, I'd like to share a quick 60-second big picture overview that Patrick Donnelly implied. About 1/3 of our island residents, estimated 228,000, are suffering from an oral health care crisis, and they're unable to access care. Unfortunately, we're now 13 years downstream of two poor decisions that were made, probably started in this room in 2019. First, we decided to close the dental division of DOH, and we let the state dental director go. Second, we decided to dissolve our adult dental benefit. The collateral damage will be hard to measure in terms of lost health, lost economic outcomes, damaged mental health, wasted emergency-only care, and human suffering among our most vulnerable and underserved. And of course, suffering is not just measured with acute and chronic pain, but it's also measured by the people that right now can't chew their food, they can't eat their plate lunch, they have an inability to smile or get a job interview, and they avoid social situations due to feeling shame. One metric of Hawaii state costs that Patrick referred to is this 5-year Hawaiian dental study that showed, the data showed $40 million were spent in ER visits for just teeth infections that all could have been prevented. So we're saying $20 million of that $40 million were direct wasted medical Medicaid funds. In 2022, some of you in this room were part of our first big win in 15 years by reinstating the benefit with $26 million appropriation in the governor's budget. We believe that there's enough vision in this room, enough talent, that if we build the right process and we pick the right people, we can save the state hundreds of millions of dollars going forward. And more importantly, we can save oral health suffering in Hawaii. Thank you so much to testify, and I'm here for any questions.
Thank you. We have Aaron Cortez testifying in support. We have late testimony from Ann Hivzdak, member of the Oral Health Coalition. Any other testifiers in the room? Any other testifiers via Zoom? Members, any questions? Questions for HDA? So you would like to have more inclusion in the task force, specifically one from each county?
Yes.
And specifically a dentist?
Yes.
Okay.
We feel that that would be a good representation of members and oral health needs from across the state.
Okay. Any further specifications potentially? Because I think in Dr. Sand's, there's some recommendations for, very specific kinds of categories.
I don't believe so.
Okay. Mr. Sand, Dr. Sand, question to you about what you would like to see as membership on the task force?
Well, there's specific, Chair Balati, there's specific kinds of dentists who have the voice of the patients that aren't here today, and they're frontline dentists in public health, in the FQHCs, in the rural clinics, and in private practice. So there are 4 very different categories, and believe me, we all have to share to heavy lift this need.
Okay, thank you. So, and those categories are identified in your.
Oh yeah, they're in the letter. Thank you so much.
All right, thank you. Members, any other questions? Okay, seeing none, moving on to House Bill 2556, testimony in support from Department of Budget and Finance. Testimony in support from Executive Office on Aging. Testimony in support from Hawaii State Council on Developmental Disabilities.
Thank you, Chair. Committee members, Dane Bartol's Executive Office, what am I doing? Sorry, Dane Bartol's Hawaii State Council on Developmental Disabilities Executive Administrator. We're in strong support of this measure. I would like to highlight in our testimony, we referred to a study. In that study, it mentions 43,000 children with disabilities that would benefit from having an ABLE account. Of those 43,000, above 40% are below the poverty level. And we really strongly feel this bill will help break that cycle of poverty where people for decades have been told, if you have a disability, don't work, you'll lose your benefits. So we're in strong support of that. Also, staff to help educate people. Last month, I went to Social Security office to help an individual put direct deposit from his SSI check into his ABLE account. The Social Security worker told them, why? You're going to lose your benefits, even in an ABLE account. And it's like, no, you're not. And we had to get the supervisor to educate her. So even though we have announced about ABLE accounts, people still don't fully understand it. That staff to go out and educate people is very important. Same with the school districts, to make sure people understand the benefit of the ABLE accounts. Also, just a question, the other bill, HB 2284, on page 2, line 6, we just want to make sure it's clarified that there is an ABLE, the trust fund is already established. It says shall be, and I'm not sure about the technical terminology, if it's is or shall be, but I just want to say it was a little different than yesterday's, so we just want to make sure that it's clarified. Thank you so much for this opportunity to testify.
Thank you. Testimony from Hawaii Disability Rights Center in support. Testimony in support, Work Now Hawaii. Testimony from Kaili via Zoom.
Kaili.
Hello.
Chair. Hello, Chair, Vice Chair, and committee members. My name is Kaili Swan. I have an ABLE account, so it helped me save up my money so it doesn't go over the Social Security asks to limit up to $2,000. So please support this bill so I can save much more money so I can spend on my trip to go to Japan.
Wonderful. Late testimony from Matthew Yamamoto. Any other
So if
testifiers?
you have any questions.
Thank you, Kaili. Any other testifiers in the room? Any other testifiers via Zoom? Members, questions? Can I just ask a question of Ms. Daintree? So I just want to make sure the language in this bill is good, or what's the difference between this bill and the House Bill 25?
Sure. On page 2, line 6, it says is, and this bill crossed out is and said shall be. So I'm not sure for the trust fund.
Okay, but and you're saying that the trust fund already does exist?
Yes.
Okay.
Mhm.
Okay, thank you. That might actually just be a kind of a technical thing that our
I
drafters
thought so,
do.
but I just wasn't sure. I apologize.
Okay,
Thank you.
thank you. Thank you for pointing that out. Members, any other questions? All right, seeing none, moving on to House Bill 2433. This is relating to public health standing orders, a governor's package bill. Members, testimony in support, Hawaii Department of Health.
Good morning again, Lauren Kim, Department of Health. Thank you for hearing this bill. It is part of the governor's package, as you say, and it's very important to the Department of Health. This bill authorizes a new concept called public health standing orders to be issued by the director, to be approved by the legislature, to improve access to preventive services. This is a conversation starter. In one part, it's to discuss what the role of, and in our evolving healthcare system, the relative role of public health and healthcare. And the space in the Venn diagram where they should be overlapping but aren't overlapping to the degree that we wish, and to reassert state leadership in health policy. That's at the sort of philosophical existential level, but at a patient level, this will allow a working parent, let's just take a mom, who would have to otherwise take a day off of work to go see her OB or internist to get physician's orders or APRN's orders to get a mammogram, then have to schedule that. So from a practical perspective, it eliminates at least one provider appointment. That's not really a loss to the provider because of pay for quality, pay for outcomes. So when I speak about this just in general to providers in the community, their eyes light up, and this is just a wonderful idea. That said, this is a work in progress. We ask that this committee keep it moving. There are lots of logistical issues that our partners in the community have identified: participation status, referral procedures, various policies that have been built up over time. And again, we've all lived through 20 years of exponential evolution in healthcare. Going for pay for office visits, you know, a lot of these tests, all of these tests that we are suggesting have been received A or B status from the United States Preventive Services Task Force, A or B rating. The federal law requires that their most insurance plans cover them at 100% with no copay. So safety levels are high, efficacy levels are high, but there are back-end issues that we need to negotiate with our partners, and we would ask the legislature to provide us some time to work on this concept that really looks to turn the conversation from a sick care system to a health care system where we start spending more resources to keep you from getting sick, to prevent you from getting sick, rather than unlimited amounts of money to keep you in your state of chronic disease. So we request that you move this measure forward while we work on it with the stakeholders. Thank you, and I'm available for questions.
Thank you, Mr. Kim. Comments from HMSA? Thank you. Support with comments, Aloha Care?
Ask the committee to consider expanding beyond the United States Preventive Services Task Force. There's other bodies that also have evidence-based guidelines, and so we can ask you to consider expanding that.
Thank you. We have testimony and support from Thaddeus Pham. Testimony and support from Chelsea Pupuhi. Any other late testimony? Any other testifiers in the room? Any testifiers via Zoom? Members, any questions? Seeing none, moving to House Bill 2434. Members, this is relating to access to vital records for the Department of Hawaiian Homelands. Testimony in support, Department of Health.
Good morning again, Lauren Kim, DOH. This is a very modest amendment that will have great downstream benefit. This amends Chapter 338-18, which authorizes only certain individuals with a tangible interest access to vital records such as birth certificates. DHHL, as you know, was awarded $600 million to clear the backlog of Homestead. One of the requirements for applicants is to demonstrate Native Hawaiian genealogy that is often best facilitated through birth certificate and birth records. This will allow staff from DHHL, with whom we are in negotiations with a memorandum of agreement to operationalize this responsibility, to have to have immediate access to vital records without having to prove on a case-by-case basis that they have a tangible interest. So this will greatly diminish administrative burden for DHHL, and I think the beneficiaries will see it on the back end with faster determinations. Thank you.
Wonderful. Any other late testimony? Any other testifiers in the room? Any other testifiers via Zoom? Questions? Mr. Kim, real quick, when you say memorandum of agreement is shortly to be executed, what does shortly mean? Because this has been something that we appropriated the $600 million like 2 sessions ago.
I can't speak for DHHL, but the memorandum of agreement between DOH and DHHL to deploy 2 DHHL staff to the Department of Health, to detail employees to work on this full time. My department is setting this up as a special project, separate and apart from the Office of Vital Records, so this does not impact business as usual. You know, everyday people still need to get their birth and death and marriage certificates. So this is being set up as a special project on the side. The memorandum of agreement is between DOH and DHHL for purposes of access to vital records for genealogy.
So do the deployment of the 2 employees, is it for like that is their only job to do that verification process with DOH? It just seems to me like once you get the backlog done, you might not need that full 2 FTE employees at DOH.
And we will revisit that as necessary. Genealogy, however, is not as simple as let's look it up. It's who's the Hanai, who's the auntie.
Got it.
A lot of it is so it's not as simple as establishing 3 generations of, say, my family. We have records that go back to King Lunalilo, handwritten in beautiful calligraphy. One side says Make, one says Haole. I mean, they never envisioned that someone who's not Native Hawaiian would ever be reading these records. So it does go back quite a ways. Our colleagues in DHHL do have a genealogy unit who I think possess the Native Hawaiian subject matter expertise. DOH staff have the vital records expertise to kind of put things together. So it's not as simple as can we just trace, Ms. Kawananakoa's lineage back 2 or 3 names on the birth certificate. There's quite a bit involved, and we have had a lot of volunteer work from the Native Hawaiian community to help us build protocols to make these processes easier, but it is still quite a lift.
Thank you. Members, any other questions? Go ahead.
Just as long as you're here on a related note, I have had constituents that I've had to help with this. They couldn't get through. My office manager went down in person and was able to help them. They had issues because their records were before a certain time when it wasn't digitized. Is there an effort to digitize those older records?
There have been discussions, and there is an ongoing discussion with the potential vendors. So we've had a couple of suitors, for lack of a better word, come in with proposals to demonstrate their technology, large companies, small companies. These are services that they have offered in other states for free, just to kind of build up a client base. There is one serious vendor with whom we are actively negotiating to see if they can put resources in our building to scan these records. There's a lot of issues with just the condition of the books. Again, they're over 150 years old, some of them. There's the issue of them being machine readable, but at least can we scan them and index them from one image to another? That's at least the start. So those discussions are actively going on with the state registrar and with our IT chief.
Thank you. Great questions. Any other questions? Seeing none, moving on to House Bill 2276. You can stay there, Mr. Kim. This is relating to the smoking sensor program, DOH testimony in opposition.
I defer to
Okay.
Ms. Irvin.
Thank you, Chair Bellotti and Vice Chair Takanouchi and members of the committee. I'm Lola Irvin, representing Director Kenny Fink for the Department of Health. And the Department of Health respectfully opposes this measure. I think we all agree that the department's job is to advance health equity so people can live healthy, live well, wherever they learn, work, gather. And that includes living smoke-free. So as Chair, you mentioned really eloquently that part of that is creating that systems approach, also changing the built environment, and also changing policy. And having smoke detectors is not a proven policy for reducing smoking. And in fact, it kind of creates more problems because what happens if you do find the person who's smoking? So once you detect it, what are you going to do at that individual level? But there are issues around that in terms of privacy. And so it is something that is very strongly discouraged. And then on the other side, there are proven policies, and we do thank this committee for moving forward HB 1778. And we look forward to that conversation in terms of looking at the amendment. And this body also had in the past moved a really comprehensive smoking law that is in place, Chapter 328J, which is one of the most comprehensive smoking laws in the nation. And so we'll continue as the Department of Health, help people live smoke-free, including prevention and helping people quit smoking. So thank you for the opportunity to provide testimony.
Thank you. Testimony in person from Kaili.
Good morning, Chair, Vice Chair, and community members. My name is Kylie Swan. I am a strong supporter of this measure because I have a health condition like people smoking at the bus stop or in the transit system waiting for the bus. That smoking really triggers my asthma. I always carry this inhaler around. So if people smoke, it triggers. And it hard me to breathe, so I have to keep using my inhaler. And people smoke pokololo out in the streets, and it gets really, really bad. So please, can you support this bill? If you have any questions, please let me know. Thank you for listening to my testimony.
Thank you for joining us, Kaili. We might actually have questions, so stay on. This is the last bill. We have support from Kristen Mills. Testimony and support late from Ann Wheelock. Testimony and support from Mayra Leonard. Any other testifiers in the room? Any other late testimony? Any testifiers via Zoom? Questions? Yes. Go ahead.
Yes, Vice Chair.
Thanks. So this is my bill. I think the intent of it is a lot. It's not really. I think it's written this way. I'm working with a couple other lawmakers in the building on this. I believe it's written for you guys to administer because it's referencing funds from the Hawaii Tobacco Prevention and Control Trust Fund. Are you guys the only department who would be able to oversee like a program like this if this is the fund that's going to be providing money?
Yes, we actually administer that fund,
Okay.
and yes.
Okay. Sorry, just
and-
for, I guess a little bit of background. It's actually, the intent of this was actually to just provide support to essentially non-smoking buildings and get a way for them to help enforce within those spaces without being too burdensome to the individuals who would be buying these detections if they're not following the rules. So it wasn't meant to be like a large, I understand your concerns and your testimony, and thank you for pointing that out. That wasn't the intent. I know I've been working with DCCA about it, but I was just wondering, I believe it was written like this because of the funding mechanism, so just wanted to make that clarification. So DCCA wouldn't be able to
Right,
oversee
and we
any
actually
of the monies.
do not have, if respectfully, Vice Chair, we also don't have the capacity to oversee a rebate program.
Okay.
We have never managed such a thing.
Understood.
So, thank you.
Okay, thank you.
Ms. Irvine, stay there a minute. Any other questions? Okay, I actually I'll be a little bit more pointed. We pass all of these laws to do smoking prevention, including smoke-free workplaces and homes. We supported that, and I think you folks have supported it in homes, right? And so as condominiums have adopted these no smoking policies, we need the support of the Tobacco Special Trust Fund to make these policies effective. I heard in your testimony, yes, we get it. It's not a policy to want to have to enforce against smokers, but this is a reasonable measure. And I think the Tobacco Prevention and Control Trust Fund monies are appropriately used to help condominiums. That you folks have, I think it was you folks who helped us, who urged us to pass these kind of laws, and even in home settings, right? And so now we have these laws, people want to implement them, and they need help. I mean, even though you don't have experience with the rebate program, if it's not complicated and there's monies in the funds, isn't this an appropriate use of the funds to help people make sure that their condominiums and places of living have the ability to reasonably enforce their own rules that you folks have pushed us to adopt?
If I may answer.
Yes, please.
Thank you. So in terms of, I think we would also work with the fire department in terms of water fire codes that would also then require already smoke detectors in buildings if we're talking about multi-unit dwellings. Our program does work and fund multi-unit dwelling trainings and policy change opportunities. We have also supported bills that have come forward in terms of providing condo associations and condo owners the ability to overcome the voting procedure that happens when there are a lot of out-of-state and out-of-country owners who are on boards. And so those who are present here, who are local residents, may be able to change the county board policies so that they can enact smoke-free condo multi-unit dwellings. And this body also has worked on smoke-free multi-unit dwellings that are state and federally owned, and we appreciate that, and we do continue to work with then our housing authority and provide them with support and training. We have also provided the Hawaii Tobacco Quit Line services for them, and so we'll continue to provide support that we know is proven. We do wonder and worry about the individual level of detection and what transpires with that kind of confrontation that happens. Unless you're seeing smoke detectors as a prevention, and that is not a proven method. But thank you for the questions and the opportunity to share what we know.
I think perhaps the smoking, as condos engage in that conversation about whether to make their condos smoke-free, maybe this rebate program is something that could help them also think through their enforcement policies so that they could move towards more adoption of smoke-free policies, potentially. There's just something to think about. I'd appreciate if you could provide the committee with a list of all the supports that you folks do offer to condominiums or homes that you just sort of listed, to make them think about adopting these kind of smoke-free places, because I think it would be helpful for us to know the kind of support that is provided to the community through the trust fund.
Okay.
Thank you.
And ma'am, we also do provide it with our federal grants as well as the general funds. So it's quite a concerted effort to provide support to our residents.
Representative Kobayashi.
Is there such a device as defined here, sends a alert, time-stamped report to the user using Wi-Fi technology?
I have not researched it, but I have looked at published articles, and it is not a proven and effective strategy. The other thing that has come up is that some people who use vapes and smokes will also then smoke into the toilet and flush it. So then what do you do with the evidence? And so there are details that we are concerned with in terms of the other questions that might arise. And we're not in a position to answer those questions. So thank you.
I think this is very expensive technology. If it's going to send a report.
We are concerned about the eligibility. Is it at an individual level that we're talking about, or is it about a condo association and the building itself? So it does open up a lot more questions.
Sounds like a pilot program, potentially. Or funding, for sure. Thank you. Thank you, Ms. Irvine. Any other
Thank you, ma'am.
questions? All right, seeing none, members, that was the last on our agenda. We will recess for decision-making at 11:30. We have a 25-minute break, so we will be resuming our agenda at 10:30 a.m. Ka'ili, thank you for joining us. No further questions for you. We are in recess. Good morning to our Committee on Health and Homelessness. It is Friday, February 9th, 2024. Happy Aloha Friday. This is for our 10:30 a.m. agenda here in Conference Room 329 and via video conference. Members, we have two bills on this agenda. We're going to need to finish promptly at around 11:10 so we can move on to our next agenda. Both of these bills relate to medical cannabis. For those of you who are joining us via Zoom, please chat with our technicians if there are any problems. Should we lose power or there be any technical difficulties, we will recess and I will or adjourn, and then we will post another notice for this hearing. We'd like to remind our Zoom participants that you should not have any copyrighted material in your background, as that will prevent us from posting this public hearing to the website. And on that note, protocol for for this committee is to do the decision-making at 11:30 a.m., so you're welcome to stay, but we will move to DM on both of these bills at 11:30 a.m. So members, first up on House Bill 1952, relating to medical cannabis, we have testimony in opposition from the Department of Health.
Thank you. Good morning, Chair, Vice Chair, members of the committee. We appreciate being allowed to testify for this hearing. My name is Liam Gimmon. I'm with the Office of Medical Cannabis Control and Regulation, representing the Department of Health. We respectfully oppose this measure and will stand on our written testimony. I am available for questions if necessary.
There will be questions, so please stick around.
I will. Thank you.
Testimony in support, in-person Hawaii Cannabis Industry Association.
Good morning, Chair and committee. We've submitted our written testimony. My name is Tai Chang, Chairman of the Hawaii Cannabis Industry Association. We stand by our comments and we're in support of this bill. I'm available for any questions if you have any.
Thank you. Comments from Akamai Cannabis Consulting. Dr. Otto via Zoom. Welcome. I haven't seen you for a while, Dr. Otto.
Good morning, Chair, Vice Chair, members of the committee, Dr. Clifton Otto. You have my written testimony, and I'd like to just make a few brief remarks. The Department of Health needs to have discretion over rules related to dispensary wholesaling, because wholesaling outside the jurisdictional limits of the state violates interstate commerce and could put the department at risk. The same thing applies to creating rules for the sale of unhealthy dispensary products. I'm referring to pre-rolled marijuana cigarettes or pre-rolls whose only intended use is to be smoked. The proper inhalation method for the medical use of cannabis is using a dry herb vaporizer. Requiring the department to adopt rules that would allow the sale of a product that is meant to be smoked violates the department's mission to protect the public health. If a patient does not have the manual dexterity to roll a joint, then they probably don't have the manual dexterity to safely hold a joint, which makes pre-rolls a fire hazard and a health risk. The solution for these issues is to keep discretion over wholesaling rules with the department and to remove pre-rolls from the list of allowed dispensary products. The sale of pre-rolls should be reserved for an adult use market. Thank you very much, and I'll be available for any questions.
Thank you. Testimony in support from Kira Oahu via Zoom or here.
Good morning, Chair, Vice Chair, members of the committee, Jenna Matilla on behalf of Kira Oahu, and we're going to stand on our testimony in support of this bill. Thank you.
Thank you. Testimony in support, Cannabis Society of Hawaii. Testimony in support, Rainbow Family 808. We have testimony in opposition from Adam on this measure, House Bill 1952. Any other testifiers in the room? Any testifiers via Zoom? And members, any questions? Okay, I have a question to Department of Health. Have you begun the rulemaking process for implementation of this law that we passed?
Yes, you mean which chapter, which law are we talking about? Yes, we have, ma'am. I'm sorry.
Specifically for the new items, which is, I believe is the pre-rolls.
Yes, we actually released interim rules for a number of the points that came up with this law, with this bill last year. In July, we allowed the dispensary to dispensary sales were part of that. We doubled the number of signs that dispensaries were allowed to use. We also allowed that maintenance and workers were allowed into licensed medical facilities. We just had to prioritize which aspects of the bill that we wanted. We want to get the dispensary to dispensary sales completed first because the licensees had pushed us to get that done, and we want to get that done as quickly as possible.
Okay, what is the timeline for the medical cannabis products?
It can be, I cannot give you a good number for that because we also have undertaken the regulation of hemp and hemp products, and we are currently working on the revisions to Chapter 1137 HAR and Chapter 329 GHRS. We need to get those finished and out, which are being reviewed as we speak, and get that out, and then we can return to start doing the other parts of this bill that we have
So
not
you
been able
have
to do
not
yet.
started it on the medical cannabis products?
We have started, and we have done a lot of background on it, and we have a plan and action in place, but it's not ready to be reviewed or to
Do
be.
you have a draft that can be provided to the committee?
No, not at this time, ma'am.
What is the timeline plan?
That would be after we complete the revisions for the.
So what is the
rules that-
date of that to begin?
I would say in February, ma'am.
February now?
Oh, was this February? I'm sorry.
So February
Yeah.
now, yes.
Yeah, that we have the rules for the hemp products, the cannabinoid hemp products are being reviewed right now. We hope to have them done by the end of the month into March. And then after that, we will be able to circle back onto these products.
Onto the medical cannabis products?
Correct.
I take offense that you say specifying a time limit for rulemaking is not only unfair to the program, it's unfair to the state legislature that enacted this law.
Yes,
And I
ma'am.
believe that it was testified to in previous committees that you folks do not intend to actually really, or want to, really effectuate the laws that the legislature has already passed.
No, ma'am, I think that we just want to take the time to make sure that we get the rules done correctly and that we have the right products allowed for our patients, for the Hawaii medical cannabis patients. Pre-rolls, there are a number of questions about what should be allowed, how much product should be in a pre-roll, what's the weight, the paper, do we have bleach paper, do we allow hemp paper, filters? There's a number of questions, and there are a number of health-related issues that we want to make sure we check every box before we just allow a product that could be dangerous to.
Are you
to
part of an association nationwide that has state regulators that have already dealt with this issue?
We
as to
do,
what
yes.
is best practices?
Yes,
Do they
ma'am.
have rules as to what for pre-rolls?
Some do, yes.
Okay, can you provide that to the committee?
Sure.
All right, thank you.
Okay.
Can I have a representative from the HCI who maybe, can you speak to that, whether or not amongst the medical cannabis regulators and dispensaries around the country, if they have some best practices already in place for the various type of products that the Department of Health apparently appears to be really taking a long time to effectuate?
Thank you, Chair, for the question. Yes, the industry is concerned that the Department of Health as regulators have slow-played or limited and really just selected what laws and what provisions of the law that this legislature has passed. There are provisions allowed. There are actually medical-only states that provide for pre-roll sales, and they have testing as well as ingredient requirements of what can be put inside a pre-roll. We've spoken with Spectra Testing Laboratories here in the state. They do have the SOPs and the testing ability, of course, to test dried flower as well as the paper and the pre-rolls of dried cannabis product. The pre-roll itself is actually not much different from the dried flower that we currently sell. It would be ignorant of the Department of Health to believe that dried flower that's purchased from a dispensary is not actually being smoked by a patient. And so to provide for pre-rolls in a limited fashion would provide some relief for patients. And we can look at a number of states that have rules, and some have very strict rules when it comes to what's allowed, what's tested, the size. Some of the concerns the Department Department of Health may have is flavored pre-rolls or pre-rolls in some adult use markets that have flavoring, or they have addition of hash or additional oil that allows the pre-roll to be much stronger than it needs to be. So, but these aren't the things that we're asking for. I think there is adequate regulation that's available for the DOH to rely upon.
Wonderful, thank you. If you could provide to the committee the states that may already have regulations around the products for which there are delays, because certainly as this bill moves forward for further continued deliberation, maybe we could amend to say not just that there's a time limit, but that maybe we should just adopt other previously adopted rules.
Yes, that would make sense. I can
And then
provide
that
you
would
with
provide
that
us with that
information.
measure of protection if they continue, the department continues to slow walk these rules.
Thank you. Yes, I can provide that to the committee.
Please provide that, thank you. Members, any other questions?
Yes.
So do you have any idea, like what percentage of patients, like what form are they getting their medical marijuana in?
I can
Because
speak-
it does
yeah.
instinctively feel like smoking is not the healthiest way to ingest it.
Yeah, so I can only speak for myself. Actually, the Department of Health does have monthly data that's available that shows kind of the breakdown of the maybe 7 or 8 product categories that they've set out. Speaking on behalf of Aloha Green, which we represent as well, we sell about 50-50 between manufactured products and dried flower. Dried flower for some other dispensaries would make up almost 80% of the sale that's been made. Dried flower, of course, can be used in a number of factors. It could be extracted by the patient themselves. They could put it in oil or olive and create their own edibles if they wish. They may also maybe use a vaporizer, which doesn't burn the product and therefore reduce the amount of tar or any type of additional, burnt chemicals that might come off. So we're not really sure about how I think all the patients use the dried cannabis flower, but I would say it's safe to assume that about 60 to 70% of all the cannabis product that's sold in the medical program is sold in a dried flower format.
Rolling papers also?
No, there is a restriction for selling any type of paraphernalia related to cannabis. So even though Dr. Otto rightly pointed out that vaporization of cannabis is a safer way of, I'd say, of administering product, we are not allowed to sell those vaporizers in our store. And so even if we were to recommend that, we do have displays that show the patient, this is a great way, it's more efficient, you use less cannabis, it's safer, but we can't sell those products in our store, and we must send the patient off to a head shop or some CBD store or some tobacco store to purchase that product. So that's another limiting factor that makes it difficult for patients. And
Thank you, good questions. Representative Amato?
Thank you. I have a question for
Yes.
Dr. Clifton Otto, actually. So, Dr. Otto, I believe you stated that patients who do not have the dexterity to roll their own marijuana cigarette, therefore do not have the dexterity to consume safely a marijuana cigarette. Is that correct?
Yes, that's what I'm saying.
Okay, so then do you believe then that those patients should be limited to capsules, lozenges, pills, or other oils or extracts of cannabis to obtain their medical marijuana?
Well, what I'm suggesting is that patients be encouraged to use a dry herb vaporizer. This is not an e-cigarette oil cartridge. This is a device that allows the cannabis to be heated to about 400 degrees Fahrenheit, at which point it releases a vapor, not a smoke. So as was pointed out, in the vapor, there is no carbon monoxide, there are no tars and no carcinogens. And studies have been done on this vapor, so we know what's in these as long as the product it works properly.
Thank you, sir.
And so one very simple solution would be to allow dispensaries to sell these devices, which are completely legal because they are designed for vaporizing all kinds of herbs, lavender, chamomile, eucalyptus. Patients are vaporizing other herbs to take advantage of the medicinal properties of the essential oils in these herbs, and they just happen to work great for cannabis. So patients have told me that if they're having problems manipulating a pre-roll or a joint, they do much better with a dry herb vaporizer because it's a larger device. It has a single button that you push to turn it on, and it can be held very, very easily by elderly patients in the palm of their hand. So I think there's a lot that could be done to make this option available for patients in terms of adding this to the list if this is something that needs to be added at the statutory level, and encouraging patients through education to make use of this method, and trying to make these devices available to patients.
Thank you, doctor. I just want to point out that as a medical marijuana patient with one functional hand, I find my vaporizer is very efficient. However, it's very difficult for me to load on my own with my one hand. So I want to point that out. However, a marijuana cigarette's quite easy for me to hold in light with one functional hand. Thank you.
Thank you.
Thank you. Members, any other questions? Thank you for the good discussion. Moving on to House Bill 2443, HD1. This is the primary caregivers bill. Members, first up, Department of Health testimony and support.
Good morning, chairs, vice chairs. My name is Kyle Brandt. I'm representing the Office of Medical Cannabis Control and Regulation today. We stand on our testimony in support of this bill. I'm available for questions if needed.
Thank you.
Thank you.
And welcome. I don't believe I met you from the department yet. Testimony in support, Aloha Green Holdings, Inc.
Good morning, Chair and members of the committee. My name is Tai Chang. I'm also acting president of Aloha Green Holdings, which is one of the medical cannabis dispensaries located here on Oahu. You have my written testimony. We support the measure that's been introduced by the Department of Health. We hope that it's a starting point, at least, so that we can allow patients to grow their own medicine in a way that suits their needs, but also provide some type of regulation so that it doesn't get out of control. There's a number of loopholes that have already been used over the last 8 years by some growers who hope to profit on medical cannabis. But if there truly is a caregiver relationship where someone cares enough to grow medicine for another person for no compensation, then we really believe that relationship should be cherished and protected. Thank you very much.
Thank you, Mr. Chang. Comments, Akamai Cannabis Consulting, Dr. Otto?
Thank you, Chair, Vice Chair, members of the committee. Dr. Clifton Otto again. Just wanted to add a few remarks to my written testimony. This bill appears friendly on the surface because it ends the sunset of primary caregivers, but it also moves up and permanently limits the number of patients who can grow together at a single grow site to 5, and expands this limitation to primary caregivers, which is absolutely the wrong direction for the program to be headed. Patients need to be able to grow together based on need, not some arbitrary number, which is why I'm proposing some minor amendments to this bill that would allow for more than 5 patients only on agriculturally zoned land, would allow primary caregivers to care for up to 5 patients, and provide a way for the department to conduct reasonable grow site inspections. If the department needs more resources to conduct these inspections, then let's hear from the department on what they need to make this happen, and let's make sure they get it. This bill also provides a vehicle for other changes that are necessary to the program that would make the program more responsive to patients. I've included these recommendations in my written testimony as well, one of which, as we just discussed in the previous bill, is removing pre-rolls from the list of approved products. I also wanted to add that making the department include these as one of their products goes against the department's mission to protect the public health, and I think this is part of the difficulty that we're seeing. So anyway, I wanted to also point that out, and I appreciate your willingness to consider these recommendations. I am available for any questions.
Thank you, Dr. Otto. Testimony in opposition, Oahu Cannabis Farm Alliance.
I'm getting better at this. Okay. Good morning, legislators. Thank you for letting me speak.
My name is Jason Hanley. I represent the Oahu Cannabis Farm Alliance. The Alliance membership is composed of 3 to 9 card doctors, patient advocates, patients, and medical co-ops. I just wanted to add comments into my already submitted testimony opposing the 5-card limit, that the Alliance would also like to add to the record that we oppose a 1-to-1 caregiver statute and believe a 1-to-many caregiver statute is a much healthier way forward to help patients. I think we need to know the history of what we're dealing with right now with these card limits, and it all starts with SB 89. It was put in behalf of Senator Jamie English, who is now serving in federal prison. And this was brought in to actually support the dispensaries, limit cards, take away the caregiver. I mean, it was just right there in plain view. And this gentleman criminally abused his powers and official position to serve his personal interests rather than the people of Hawaii. And this is what we see over and over again. At this time and day right now, there's plenty of data that shows that over 50% of the 40,000 cardholders in Hawaii are not using dispensaries because they are too expensive or they do not have the medicine they need. We know that sites with more than 5 cards, referred to as collectives or co-ops, are becoming increasingly popular and providing a safe medical growing facility for thousands of patients. These co-ops test their medicine, I am attest to that, regularly to provide a safe product to the patient as well as educates the patient on all uses. The Department of Health testified last year in HB 1217 to the Finance Committee that there has not received any complaints from patients at these co-ops regarding tainted products. This is really important, you guys. Addressing the caregiver provision, we believe that the 1-to-many caregiver license is appropriate. The reason the caregiver license exists is because they are caring for a patient. That patient cannot grow their own cannabis because of a variety of medical reasons. Co-ops easily fill this niche and provide caregivers for hundreds of patients, and we have the data for that. Okay, sorry. Cooperative grows have been around for 20 years, long before dispensaries. They are a vital part of the community. Limiting cards will not drive people to dispensaries. It will leave people without medicine. Many of our patients would never conceive of going to the black market. It's unlawful. What we're dealing with right now in this committee is the state has put in a detailed regulation, this medical bill, and we asked the committee to take a look at other states and things that are going on right now. We do have a bill in SB 2619, which is a full overhaul of the Medical Use Cannabis Act. It's sitting with Senator Ah. We don't think it's going to go very far, but this is a main cut and paste for a 12-year professional medical cannabis program that's been thriving in the state of Maine. Okay, that's my ramble. Thank you so much for hearing me. Aloha. If you have any questions, please don't hesitate to ask. I would like to add to the pre-roll thing. We have data right now that shows the pre-roll in the medical market across the United States is the most popular product being consumed right now, the pre-roll, 100%. The data is out there, you guys. Thank you. Aloha.
Thank you. Testimony in support, Cannabis Society of Hawaii. Testimony in support, Noah Botanicals, Mr. Jarvis.
Chair, Vice Chair, members of the committee, thank you for the opportunity to testify. I will largely stand on my written testimony with just a couple of comments in response to some of the discussion here today. Mr. Hanley represents that dispensaries are far more expensive than the illicit market and the co-ops as well. That is just, it's a convenient narrative, but it's false narrative. You can go into, Ty is one of my competitors here on Oahu. We have a representative from one of my other competitors here on Oahu. I wake up every morning and peer over their fences to see what they're selling for, see what the range of their products are. And I can tell you that all 3 of us have products that are at or below the black market prices today and on a regular basis. I'd also say that what's happening here with this fight to avoid any restrictions on the number of cards that can be stacked in a single location is really just cooperative proponents trying to have the scale and for-profit potential of large-scale dispensaries without having the regulation. And we believe that's not in the public interest. It's not in the interest of public health as well. And I want to thank you for the opportunity to comment.
Thank you, Mr. Jarvis. Excuse me, order. We have the rest of the testifiers to go through. We have numerous, thank you, Mr. Jarvis. We have numerous testimonies in support and numerous testimonies in opposition from individual supporters. Any other testifiers in the room? We did receive one late testimony, I believe. Any other testifiers in the room? Any other testifiers via Zoom? Seeing none. Members, questions? No questions? All right. No, sorry. I think we are well briefed on this. So members, we are going to recess and we will take up decision-making at 11:30 a.m. We are in recess. Good morning. Convening our decision-making hearing of the Committee on Health and Homelessness. Today is Friday, February 9th, 2024. This is 11:15 AM agenda. This is only a decision-making hearing or meeting for two bills, House Bill 407 and House Bill 408. Members, I'm going to take the bills out of order. We're going to take first up House Bill 408, and this is just a routine, formal measure, members. House Bill 408, titled Relating to Health, is a short-form bill referred to the Committee on Health and Homelessness. Our consideration of the measure today is for decision-making purposes only to insert substantive provisions into the short-form bill. A public hearing will be scheduled at a later date, at which time testimony will be accepted. Pursuant to Rules 11.54 of the Rules of the House of Representatives, the Chair's proposal is to amend House Bill 408 by inserting substantive contents within the scope of the bill's title and to issue a committee report recommending recommittal of the bill to this committee for further consideration. Members, I'm passing out, my staff is passing out House Draft 1 for 408. The committee referral for 408 HD1 will also be reviewed by the Speaker. A proposed House Draft 1 has been prepared and distributed to the committee members now. For those members who are not here, we will also distribute this proposal. The proposed HD1 authorizes the Department of Health to certify community care foster family homes for 4 Medicaid beds and to place 1 additional Medicaid individual in the same community care foster home under certain conditions and at its discretion, and requires a report to the legislature. Members, this proposed short-form bill was worked out with the new statewide coordinator on homelessness and housing solutions, Mr. John Mizuno. This is a proposal that would help to provide more housing for those experiencing housing instability. We know, members, that Kupuna make up a large part of the homeless and at-risk homeless population, and so this is an innovative measure that has been in discussions with Mr. Mizuno and numerous legislators, as well as some conversations with departments that will be having to potentially implement this innovative solution. So that's why this short-form bill has been developed and why I'm offering this as a proposed House Draft 1. Are there any questions or comments by the members? Seeing none, members, Chair's recommendation is to pass House Bill 408 with amendments and to recommit House Bill 408 HG1 to this committee for a future public hearing. Vice Chair for the vote.
Members voting on HB 408, Chair's recommendation is to pass the short form bill with HD to recommit for future public hearing. Chair and Vice Chair vote aye. Representative Amato?
Aye.
Representative Iligan is excused. Representative Kobayashi?
Aye.
Representative Martin?
Aye.
Representative Nishimoto is excused. Representative Garcia?
Aye.
Chair, recommendations adopted.
Members, moving back to the top of the agenda, House Bill 407 relating to health. The substantive contents of this proposed House Draft 1 are still have not still been finalized, but I did want to give some context as to why this measure is being placed on the agenda. Members, the committee received an AG's opinion, which my staff member is passing out, on January 17th, 2024, which was in advance, which was on opening day. Short form bills are precisely for this kind of situation where there is new information brought to the legislature, and then we are unable to craft proposals, in order to meet the deadlines. So this AG's opinion was provided on January 17, 2024. I'm providing you this AG's opinion. You can take and review it. There is a discussion about what the substantive contents for a proposed House Draft 1 to pass out in light of this new information received by the committee. So Chair's recommendation at this time is to defer decision-making on House Bill 407 to Wednesday at 11:15 a.m. That would be Wednesday, February 14th, at 11:15 a.m. Members, any questions? Seeing none.
I'm sorry. What are you going to insert in this, the AG opinion or a bill?
Well, that's what I'm saying. The substantive contents for the House Draft 1 has not been finalized yet, so we will do a proposed House Draft 1. I'm pushing back the decision-making for this till Wednesday, February 14th at 11:15 a.m. And at that point, we'll have a HD1 in which to insert in response to this AG's opinion.
On
Okay.
birth attendance.
Yes. Okay, members, any questions? Seeing none, this is adjourned. This meeting is adjourned. Reconvening our 8:30 AM agenda that starts off with a joint committee hearing on health and homelessness and human services. Members, great discussion on a House Bill 1834. This is relating to the increase for the Homeless Programs Office within the Department of Human Services. Chair's recommendation is to pass out an HD1, continuing to keep the blank appropriation, but adding language to make this a recurring appropriation, noting in the committee report that the range from 5% increase to a 20% increase and the noted numbers, and to strongly recommend the imposition of a 20% increase, which is really, members, at the end of the day, only a $5 million appropriation. And to put in a effective date. Members, any questions, comments, concerns? Seeing none, Vice Chair for the vote.
Health Committee voting on HB 1834. Chair's recommendations to pass with amendments. Chair and Vice Chair vote aye. Representative Amato.
Aye.
Representative Iligan.
Aye.
Representative Kobayashi.
Aye.
Representative Martin. Aye. Representative Nishimoto. Aye. Representative Garcia.
Aye.
Chair, recommendations adopted.
Thank you. Oh, and Human Services for the chair. Human Services to the chair.
Oh, I'm so sorry. Same recommendation for Human Services Committee. I keep forgetting it's joint. Vice Chair, please take the vote.
Thank you, Chair. Human Services Committee voting on HB 1834. Chair's recommendation is to pass with amendments. Chair and Vice Chair both voting aye. Representative Belatti.
Aye.
Representative Iligan.
Aye.
Representative Kobayashi.
Aye.
Representative Takenuchi.
Aye.
Representative Nishimoto. Representative Garcia.
Aye.
Thank you, Chair. Your recommendation is adopted.
Thank you. Moving to House Bill 2448, relating to mental health services for children and adolescents. Members, this is a governor's package bill. Chair's recommendation is to defer, as the Senate bill is currently moving, and this is just to help with our own workflow on our side. Members, any comments, questions, or concerns? Okay, moving on, now we're going on to just health bills. House Bill 2042, relating to mental health. This is to appropriate funds for mental health and wellness needs of youth in the state. Chair's recommendation is to pass this out with a effective date of 3,000. Members, comments, questions, or concerns?
Any dollar amount?
Oh, we will leave that for testimony for the, I believe there might have been a.
There's a dollar amount. Is that mine?
Yes.
There's a dollar amount.
Oh,
Put in the committee report.
we will put the, thank you, Representative Kobayashi. If there is a dollar amount in the bill, we will extract it from the HG1 and put it into the committee report. Okay, any other comments, questions, or concerns? Vice Chair for the vote.
Members voting on HB 2042, Chair's recommendations pass with amendments, noting the presence of all members unless otherwise noted. Any reservations or no?
Reservations.
Reservations for Rep. Garcia. Chair, recommendations adopted.
Thank you. Okay, moving on to House Bill 2182, members, relating to community health workers. Really great discussion. I think we need to do a little bit of work over the weekend, so I'm going to defer this for decision-making on Wednesday, February 14th at 11:30 a.m. on the 11:30 a.m. agenda. Members, moving to House Bill 2544, relating to medical transportation. Again, another good bill with lots of discussion. Chair's recommendation is going to be to defer this for decision-making on Wednesday, February 14th at 11:30 a.m. Members, moving on to House Bill 1777. Okay. Chair's recommendation is to pass out House Bill 1777, relating to dental hygienists, with a effective date, HG1, and there are no other tech amendments for this one. Members, any questions, comments, or concerns? No. Seeing none, Vice Chair for the vote.
Voting on HB 1777, Chair's recommendations to pass with amendments. Any reservations or noes? Hearing none, Chair recommendations adopted.
Okay, moving to House Bill 2744, relating to oral health task force. Members, there's some questions about needing to add other representatives. So just so that we can work on this, Chair's recommendation is to defer this for decision-making on Wednesday, February 14th at 11:30 a.m. Members, moving to House Bill 2556, relating to the Hawaii Able Savings Program. We've heard comments, testimony on this and another previous bill that was sitting in Human Services. Chair's recommendation is to further defect the date so that we have a House Draft 1 on this bill. Any comments, questions, or concerns? Seeing none, Vice Chair for the vote.
Voting on HB 2556, Chair's recommendations to pass with amendments. Any reservations or noes? Hearing none, Chair recommendations adopted.
Okay, moving to House Bill 2433. This is relating to public health standing orders. Members, this is again a governor's package bill, so Chair's recommendation is to defer this. House Bill 2434 relating to access to vital records for the Department of Hawaiian Homelands, also governor's package. Senate bill is moving. We can also get further information on the status of the MOA between DHHL and DOH when this bill comes over, so Chair's recommendation is to defer this. Relating to smoking, House Bill 2276, Chair's recommendation is to continue to move this along for further discussion. HD1, technical amendments needed for clarity, consistency, and style, as well as a defective effective date. Members, comments, questions, or concerns? Go ahead. Representative Martin first.
I just wanted to mention I'll be voting with reservations. I just have concerns about the public resources being used for private condominiums. Unless it's a public housing. No, it's private. Yes, I do have concern about that.
Okay, thank you. Representative Kobayashi?
I think I'm a no on this. I'm not sure how a smoking detector differentiates between cigarette smoke and other kinds of smoke. And this bill requires that the smoke sensor send a alert, time-stamped via Wi-Fi technology, which means it's a very complicated system, not just a battery-operated smoke sensor. And it sends this a report to the user, supposedly to the unit owner. Anyway, lots of issues.
Yes, and I think we're going to be getting a lot of information from the Department of Health on how they're assisting condominiums, homeowner associations, especially because they've been urged to adopt smoke-free, rules. And so I think this is a good measure to continue to move along. So reservations are noted as well as comments. Any other questions, comments, or concerns? Seeing none, Vice Chair for the vote.
Voting on HB 2276, Chair's recommendation is passed with amendments, noting the reservations from Representative Martin. Any other reservations?
Reservations.
Reservations for Rep. Garcia. And Rep. Kobayashi's no vote. Any other no votes? All others vote aye. Chair recommendations adopted.
Okay, members, I got a question from the staff, and I just do want to confirm I have deferred House Bill 2434. We're going to wait for the Senate bill for that as well. Okay, so both House Bill 2433 and 2434 has been deferred. Okay, members, moving to our 10:30 a.m. agenda. Our 10:30 a.m. agenda. Okay, members, great conversations with this. In consulting with the previous committees, Chair's recommendation is to move House Bill 2443 HD1 forward as is. It has a draft on it, so it meets kind of our expectations as it moves into the final committee for final consideration. So Chair's recommendation is to pass House Bill 2443 HD1 as is. Okay. Vice Chair for the vote.
Members voting on HB 2443 HD1. Chair's recommendation is passed as is. Any reservations or noes? Seeing none, Chair recommendations adopted.
Members, I'm sorry, I jumped to the second bill first. So I'm now going back to the first bill on our 10:30 a.m. agenda, House Bill 1952 HD1. This one also has a House Draft 1. As it moves into our Finance Committee, I've conferred with the conveners or the co-chairs in the previous hearings, and so we are going to just move this one as is. Move this one as is for further discussion and consideration by the Finance Committee. Vice Chair, for the vote.
Voting on HB 1952 HD1, Chair's recommendation is passed as is. Any reservations or noes? Seeing none, Chair recommendations adopted.
Members, we are done. This is adjourned. We'll see you on the floor and have a happy Super Bowl Sunday. Adjourned.